Hello friends, you might have seen that many sports demand a good eye-hand coordination. Table tennis, for instance, or many such sports. Even in cricket, we see a few sports persons or cricket players who don't have that much great footwork, but they still excelled because of a good eye-hand coordination. The name that comes to mind is Virender Sehwag. He used to have a good eye-hand coordination. So what is the circuit behind eye-hand coordination, and which neurons are responsible for this? We will see that in this particular video. And so far as the first year is concerned, you get a short note on eye-hand coordination from the CNS, and for PG entrance exam preparation also they can ask MCQ on this particular topic. So let's check out what's the circuitry involved in the eye-hand coordination. Right, now first thing is, the word is eye-hand coordination, or some people call it hand-eye coordination. Well, it starts with the vision, of course, because it's the eye vision. We see the things, and then the signals have to be sent somehow to the cerebellum, because cerebellum is the ultimate master coordinator for all our voluntary movements. Coordination between various muscle groups is the function of cerebellum. So signals have to be sent into the cerebellum, visual signals sent into the cerebellum, and then cerebellum, based on those signals, will execute the coordination between muscle groups, particularly the hand muscle groups, and that would be the eye-hand coordination. So the circuit is like this. From the vision, from the visual pathway, one set of collaterals is sent to a structure called as superior colliculus. Now let me tell you a few things about this. We are talking about the midbrain. Roof of the midbrain is called as tectum and floor is called as tegmentum. We are concentrating on tectum. This tectum has got four bodies: two superior colliculi, two inferior colliculi. So tectum means superior colliculus and inferior colliculus. Right. Superior colliculus is associated with the visual pathway, and inferior colliculus is a part of auditory pathway. So we are not concerned with that right now. So the visual signals sent into the superior colliculus, the tectum, and from there, from the superior colliculus, the signals are sent into the cerebellum. Finally, the signals have arrived in the cerebellum. This pathway is called as tectocerebellar tract. Tectum, that is superior colliculus, to the cerebellum, tectocerebellar tract. Now based on these inputs or these signals, then the cerebellum will send the output signals onto the spinal cord. In addition to that, the tectum, that is superior colliculus, will also send the fibers down on the spinal cord. They are called as tectospinal tract. This tectospinal tract controls the movements in response to the visual inputs, and additionally the cerebellar signals coming on the spinal cord will assist these the signals of the tectospinal tract. So these two tracts reaching the spinal cord work in close association and finally will achieve the hand muscles coordination. So that's how the eye-hand coordination is achieved, and better eye-hand coordination means better functioning of these circuits, and therefore how you can improve the eye-hand coordination is simply more and more practice, more and more learning, because that will lead to consolidation of these synapses, and your eye-hand coordination for that particular specialty will improve. But in short, this is a circuit, and the structure that is central to the eye-hand coordination is the superior colliculus. So that was a quick explanation about eye-hand coordination. For more such explanations, why not subscribe to the channel and hit the bell icon.